Mental illness among children and youth is a complex, wicked problem our society must overcome. 1 in 5 Ontario children will experience a challenge in mental health during their school years. However, only 1 in 6 will actually seek out and receive the medical care that they need. The following is an example of how nurses can work at the policy level to propose options and make recommendations to address this issue.
Mental illness among Ontario's youth is a wicked problem. When someone becomes physically ill in Ontario, they are able to access health services and other resources. However, mental illness is not always given the same level of priority. A majority of adults living with mental illness first experience symptoms during their childhood or adolescence. Individuals living with mental illness experience barriers throughout their lives in education, employment, and housing. The negative stigma associated with mental illness prevents a large number of the population from accessing care.
A substantial portion of those who have found and accessed resources for mental health have reported unsatisfactory treatment and support. Education is an important factor in reducing the stigma associated with mental illness, especially among youth. Programs and resources should be directed towards youth in communities and schools to ensure adequate care is available. This problem is difficult to solve due to the economic restraints associated with it in relation to medications, available hospital beds, and implications of community-based programs. Therefore, it is important to implement preventative approaches such as health promotion rather than spending healthcare dollars on adverse effects.
So Dave, as a nurse, how do you think we can tackle this wicked problem?
Well, my team dug into the issue, and I'm here to present you today with 3 options. The first option is just the status quo of what's currently going on in Ontario.
So what is the current plan?
The current plan is Ontario's Comprehensive Mental Health and Addiction Strategy, which stretches from 2011 to 2021. It has an initial 3-year focus with $93 million invested in goals of mental well-being, early intervention, housing, justice systems, and timely care. The strategy claims responsibility for thousands of extra children accessing resources and services. However, it does not have an effective plan to evaluate accomplishments. Therefore, the results may be difficult to interpret as effective or not effective.
So Dave, tell me about your second policy option.
Well, the second option would be to renew the goals of Ontario's policy framework for children and youth with mental health.
Okay, and how will this recommendation be effective?
This recommendation will build off the current existing framework that has been outlined as evidence-based interventions to improve the well-being of children and youth with a mental illness. The renewal will also implement strict timelines and milestones to be reached by the province in order to hold this mental health program accountable for their actions and assess whether it is effective or not.
Okay, and who will these policies focus on?
These policies will affect all children in Ontario, but it will also focus on the most at-risk populations, such as Aboriginals and homosexual youth.
So do you have any further options?
Yeah, we have a third option, and this is actually the option we recommend. And this is where we want to use early identification and screening in the provincial school system.
So how will this be beneficial, and will it increase the diagnoses of mental illness?
This recommendation is most beneficial and the option that we should be implementing because through the integration of early screening, education, and awareness, stigma associated with mental illness can be reduced throughout the provincial school system, as well as we can increase the access to resources within schools and the school community. By identifying mental illness among children, we can decrease long-term deficits and improve their functioning in school.
So David, how will this decrease the stigma associated with mental illness?
By bringing mental health care into schools, we are taking a preventative approach to reduce the rates of undiagnosed mental illness through improved resources and access. Through the promotion of mental health care and education, we can normalize mental health and reduce the associated stigma.
Okay, and how cost-effective will this policy be?
By making resources available through the school, we also decrease the cost to the individuals who are accessing care. And by building on existing programs rather than developing completely new policies, we are decreasing government spending through these programs.
That sounds like a great recommendation.
To complete this goal, we are going to need collaboration from many different sectors. Political figures, healthcare systems, educational institutions, and community leaders will need to collaborate to implement this plan. Upon implementation, we will begin to reduce the stigma that prevents youth from accessing care, treat the symptoms associated with mental illness, and promote health and well-being as these youth transition into adulthood.
Sounds good. Let's get to work.